Okay, we're going to move on to surgery, and our topic is going to be post-operative fever. And we're going to begin with bacteremia. Bacteremia is a fever exceeding 104 degrees Fahrenheit, and the onset of chills 30 to 45 minutes after the start of a procedure. If you see fever over 104 with chills and fever 30 to 45 minutes after the procedure started, I want you to think it's going to be a bacteremia, and we're going to manage these patients with blood cultures times 3 and then the immediate start of antibiotic therapy. Next is atelectasis, and atelectasis is pretty important because it's our most common cause of fever post-op day 1. Now, how do we manage these patients? First, we want to do a chest x-ray, and then we're going to do incentive spirometry as well as deep breathing exercises, and we want to basically improve ventilation in these patients by doing these things. And if all else fails, we're going to go to bronchoscopy, but we only do bronchoscopy if it's absolutely necessary. Our next topic after this is pneumonia, and pneumonia is going to occur 3 days post-op if there's no recovery from atelectasis most of the time. So if we see post-op fever day 1, I want you to think atelectasis. Post-op fever day 3, I want you to think pneumonia, and it's usually because of an unrecovered atelectasis. And on the chest x-ray, we're going to see infiltrates, and we're going to manage these patients by sputum cultures followed by antibiotic therapy based on the sputum cultures. UTIs are also fever that starts post-op day 3, and we're going to manage these patients with urinalysis and urine cultures, and we're going to treat based on the results of the urinalysis and the urine cultures. So day 1 post-op, atelectasis is the most common cause of post-op fever, and on day 3 we can get pneumonia or UTI, and usually if it's the pneumonia, it's going to be because of an unrecovered atelectasis, and we're going to do sputum cultures followed by antibiotic therapy. And if it's a UTI, it's going to be a fever that starts post-op day 3, and we're going to manage them by getting urinalysis and urine culture and treating them with antibiotics based on the results. Post-op day 5 fever, it's going to be deep thrombophlebitis. This is going to be fever that starts on post-op day 5, and basically we're going to manage these patients based on the Doppler of the deep leg and the pelvic veins. And we have to anticoagulate these patients with heparin. It's really important. And remember, usually the physical exam is worthless in these patients, so we have to do a Doppler of the deep leg and the pelvic veins and anticoagulate these patients with heparin. So post-op fever day 1, what is it? Atelectasis. Fever 30 to 45 minutes after the start of the procedure, bacteremia. Post-op fever day 3, it's going to be either pneumonia or UTI. If it's a pneumonia, it's usually because of an unrecovered atelectasis. And post-op fever day 5 is going to be deep thrombophlebitis, and we're going to do a Doppler of the deep leg and pelvic veins, and we're going to anticoagulate these patients with heparin. Post-op day 7, we're going to be thinking wound infection, okay? And on physical exam, we're going to see warmth, we're going to see tenderness, we're going to see erythema, okay? And post-op day 7, if there is an abscess present, we're going to do drainage of this abscess. If there's cellulitis, we're going to treat these patients with antibiotics accordingly. And if you can't tell the difference between these two, we're going to do a sonogram diagnostically to distinguish between them, okay? So post-op day 7 is going to be wound infection. If it's an abscess, we're going to incise and we're going to drain. If it's cellulitis, we're going to give antibiotics accordingly. And if we can't tell these two apart, we're going to do a sonogram to diagnostically distinguish between them. And a deep abscess usually occurs on post-op day 10 through 12, okay? Sometimes people say 10 through 15, but this is going to be a deep abscess, and basically we're going to do a CT scan of the appropriate body cavity, and the management is going to be percutaneous radiologically guided drainage. And this is all our causes of post-operative fever. So quick review: 30 to 45 minutes after the start of the procedure, we're thinking bacteremia, and we're going to do blood cultures times 3 and start antibiotic therapy. Post-op day 1 is probably our most important one to know. Post-op fever day 1, atelectasis. We're going to do chest x-ray, and we want to improve their breathing by doing incentive spirometry and deep breathing exercises. And if this fails, we're going to do bronchoscopy, but only if it's absolutely necessary. Most of the time, if they don't recover from the atelectasis on day 1, they can go to pneumonia, which is a cause of post-op fever, post-op day 3. And we're going to do a chest x-ray. We're going to see infiltrates. If we see these infiltrates, we're going to do sputum cultures followed by antibiotic therapy appropriately. UTI also occurs on day 3, post-op fever day 3. And we're going to do urinalysis and urine culture and treat these patients with antibiotics based on the results. DVT is going to be post-op day 5. Remember, physical exam is pretty useless in these patients, so we have to do Doppler of the deep leg and pelvic veins and anticoagulate these patients with heparin. If we see fever, post-op fever day 7, if it's going to be an abscess, we're going to incise and drain them, and if it's cellulitis, we're going to give them antibiotics. Remember, if we can't tell these two apart, we're going to do a sonogram diagnostically to distinguish between them. And if the fever is post-op day 10 through 12, we're going to do a CT scan of the appropriate body cavity, and we're going to do a percutaneous radiologically guided drainage, which is going to be therapeutic in these patients.